Welcome back to the show, everyone. Here to talk to us about regenerative medicine and stem cells from the Goswami Clinic. We welcome Dr. Gaurav Goswami to the show.
Thank you. Good morning. Thanks for having me.
How are you?
Good.
I'm so excited to talk to you. We've talked a little bit before we started the show, and you use the same word that I have in my talking points, which is buzzword. And I do think that we both agree that regenerative medicine, stem cells, those are definitely buzzwords that seem to be hitting multiple podcasts.
Yes.
Right? Everywhere you look.
Right.
It's just one of those newer types of phrases and words that we're seeing a lot. But let's get back to what you do and how you actually help people with regenerative medicine.
Right. So this is my 15th year of practice. I'm by training a surgeon and an interventional radiologist, and then also board certified in the American Board of Regenerative Medicine, which is a fairly new board. And the reason my career trended in this direction was because I was part of mainstream medicine. You know, I was faculty, University of Washington, Seattle, and then also director at Long Beach Memorial Hospital. But what I was seeing, especially in the area of orthopedics and sports injuries, we weren't really helping patients. You know, a lot of these patients would keep getting cortisone injections, steroids, which sort of destroy the joint. And then eventually they would move towards having surgery. And then the ultimate end stop was having joint replacement.
Wow.
And so I felt, the functional outcomes after these treatments were not that great.
Right.
And so that is where I think regenerative medicine right now in its current shape and form has the biggest impact on how to keep you active for as many years as you're alive, and also help you experience a superior quality of life because you can play the sports, you can stay active, you can travel. And we are all headed in that direction, right? I mean, the wear and tear of life, right, takes. So this is not a disease process we're talking about, but we're talking about like really keeping people active for as long as they want to be.
Right. And so this, the whole regenerative medicine, stem cells, do you think that the medical community will eventually sort of take that same route that you have, or will they stay pretty traditional?
Right. So, the devil is in the details always. So I think with anything new, unfortunately, sometimes marketing goes ahead of science. And it's unfortunate that a lot of places, offer these treatments, but they may not be done correctly, or patients may not be seeing the benefits they want. So our focus at Goswami Clinic has always been about results. I'm not a doctor if you're looking for another stem cell injection, but if you're looking for results, then yes, stem cell at the end of the day is another tool in my box. How it's applied, how the treatment is done is very, very important. So we need more success stories out there. And I think then eventually, yes, I do think like anything else, mainstream medicine will start having this. Already as part of the American Board of Regenerative Medicine, I'm a board examiner. I conduct training courses for other physicians and nurses who are interested in the field of regenerative medicine, so they can learn things the right way. But that's what we need right now, is more success stories, more people saying that this has benefited them. And I think eventually the walls of insurance and mainstream medicine will come down.
They'll have to follow suit.
Yeah.
So tell us, what are you mostly focusing on there in your clinic over in Newport Beach?
So most of it is, joint pains, knee pain, shoulder pain, and then back pain. Those are our three commonest sites. Obviously, we treat a lot of other orthopedics, sports injuries too, everything. And like I mentioned, stem cell is a tool in our box, right? Everything starts with a proper diagnosis. Everybody is not a candidate for stem cell treatment. Sometimes surgery is what you need as much as you want to avoid it. So everything starts with a proper evaluation of where the patient is, what the goals are. And then even the treatment protocol, if you're undergoing a stem cell treatment, varies from patient to patient, depending upon what their condition really is and what outcomes and results they're looking for. So everything has to be customized. It's not one size fits all. So a lot of planning goes into figuring out, and as a surgeon, I'm aware surgery has a role to play. So some patients do need surgery, and that's where we guide them.
So that's very interesting. So you're diagnosing on the very early onset of, you've got pain in your elbow. Let's say you've played tennis for 30 years, you've developed some maybe joint conditions, arthritis. Yeah. And so do you take a look at that particular condition and say, okay, this is how far I can help you, and perhaps you don't need surgery, or maybe there's nothing I can do here and you do need surgery?
Absolutely.
So you're sort of walking your patient all the way through.
Correct.
What's possible.
Yeah, it continues to baffle me how many patients actually are walking around with improper or incorrect diagnosis. And when the diagnosis is not correct, you're not going to know. Tennis elbow, could be as simple as an inflammation at the elbow. You brought up the elbow, and I was just talking to a patient last week. Or there could actually be a tear in that muscle. So a lot of patients will, undergo what their doctors will routinely recommend, either a cortisone injection or take some time off from their sport, but they're still not healing, and they're not healing because it's not. Luckily for me, my career has taken me through multiple specialties. So I do an ultrasound evaluation of the joint during the consultation, and then make a right diagnosis, and then if need be, we will send the patient for an MRI. But even in the MRI, I've seen sometimes the radiologist hasn't seen the patient. So sometimes the MRI report could be filled with a lot of redundant information, which is actually not the cause of your symptoms. And what happens is these patients, when they go to a surgeon, they're treating the MRI findings rather than treating the patient. So a lot of finesse and knowledge and experience is needed to apply regenerative medicine tools correctly.
Dr. Goswami, I can assure you nobody is taking the time that you are with your patients. Yeah. I feel that about you. It just feels amazing that you take so much, you have a lot of passion for what you do, right? And for the people that you care for, in order to take that amount of time and intricate detail into everybody's cases. Where did that passion come from?
I think, as a physician, I say that we spend a lot of years in training, a lot of years learning our craft, and then which I don't necessarily see as a positive, because we end up lacking a lot of other skills. We're not businessmen, we're not. Right. But at the end of the day, I mean, the whole purpose of being in medicine is to help, and I often tell people, if I was a businessman, I would probably be making a lot more money and giving a lot more to charities. But medicine is the only profession where my work is my charity, right? And when a patient comes to me and trusts their body, I mean, how often can you go and touch someone just out of the blue? You cannot, right? But when a patient comes to a doctor, he's really offering his complete trust to the doctor. Absolutely. And it's my job to make sure I don't let them down.
Tell us, what is PRP?
So PRP is platelet-rich plasma. Platelets are a type of cells in our blood. We have red blood cells that carry oxygen. We have white blood cells that fight infection, and then we have platelets. So when platelets have 10 to 12 very good growth factors. They're not stem cells, but sometimes that's all is needed. So we draw the patient's blood, we have to spin it to remove the red and the white cells, and then we're left with platelets in the fluid of the blood, which is called plasma, and that's where the name platelet-rich plasma comes from. And it's just an entry point into the world of regenerative medicine, but like I mentioned, there are a lot of patients who sometimes need just a good PRP treatment. The problem is there are 20 different ways of making PRP, and 17 don't work.
Oh, no.
So I write it in my book, so it's very important how this is prepared for what indication. Like PRP going into the joint is different than PRP going into a tendon or ligament. PRP used for shoulder pain can be very different for PRP used for plantar fasciitis. And then PRP has a lot of applications even in the cosmetic world, the vampire facelift. That's exactly, they use PRP, but then that PRP has to be prepared very differently than the PRP. So I think as we do more and more procedures, we're learning more about the regenerative aspect.
And you authored a book called The Stem Cell Cure.
Yes.
So if our viewers want more information or want to read your book or find out basically what you're doing in your clinic, they can pick up the book. Where can they get a copy?
You can get a copy wherever books are sold, Barnes & Noble and Amazon. And the whole purpose of writing that book was to educate the common folks, because as you know, these treatments are currently not covered by insurance. So, not only patients are putting their trust, but also their hard-earned money and savings into these treatments. I wanted them to have, and then I highly encourage, spend the $15 on the book before you go around spending thousands of dollars, getting these treatments. So at least you will have an idea of the questions you should be asking your provider.
Well, with that, Dr. Goswami, thank you so much for joining me today.
Thank you.
Really
Thanks a
appreciate you
lot.
being here.
Thank you very much.
The Goswami Clinic in Newport Beach.
Thanks.
You're watching This Day on Village TV. We'll be back after these messages.